Breakfast for Hungry Children is a community-oriented program which aims to feed children for financial reasons or otherwise don't eat breakfast before coming to school. We are going to discuss the needs, such as the existing community need and program gap. Breakfast is often said to be the most important meal of the day. There are general numbers that represent a significant portion of the population which could benefit from the implementation of this program. According to these statistics from the Conference of Canada, Canada has a child poverty rating of 14.7, making it the second highest among 16 other countries that have similar socioeconomic trends. In terms of Canadian provinces and territories, Ontario has the fourth highest rating of 16.6% in the same category.
Here we're going to observe a case study from A.R. Kaufman. Test results from A.R. Kaufman, which is a school under the jurisdiction of the Waterloo Region District School Board, show that 42% of test results are below the provincial standard. This means that the school is unsuccessful in ensuring that most of its students are meeting or exceeding the provincial standard for test performance. In comparison to every school in Ontario, A.R. Kaufman is in the 20th percentile, being in 2,555th place out of 3,064 schools. Knowing this, it would be a step forward in the right direction to perform an assessment which would determine the gaps that the program intends to fill by providing food to students.
Now, we are going to talk about the program and its overview of major costs.
In order for this program to be successful, planning and organization is important. Undergoing thorough planning before implementation will help prioritize issues and set goals, which will result in developing a plan for action. After a final plan is decided and the program is implemented, the steps that follow are to monitor, reflect on, and evaluate the performance and outcomes of the program. The first step involves assessing the need for the program and setting goals. Assessments include collecting data from the desired school, how many students the program will need to feed, available equipment for food, storage, and expected costs.
Next, planning includes gathering school staff or community volunteers which will oversee the program, deciding on a location, deciding on the type of food that will be made available, and ensuring that the initiative will follow all guidelines and school policies. It is vital to keep track of all decisions being made during the process. We are now going to look at the overview of major costs. An important consideration in the planning process is budget and expected monetary costs. For this initiative, costs would include storage for food and the cost of the snacks per child. Based on the school population, this will vary from school to school. However, since most funds will be going towards the purchase of the food, this value can be represented at the price of one breakfast per child per day in a school year. Because it is possible to buy groceries in bulk, considering the cost of feeding one child to be approximately $4 a day. If there are 100 days in a school year, this would bring the cost to approximately $720 per year.
Fundraising is one way to manage the costs incurred by the program. For example, a recurring community bake sale. Costs are an important factor to consider when introducing this program in order to accurately plan every aspect of its implementation and aid the decision-making process.
Now, we're going to talk about how our proposal aligns with Waterloo Wellington's LIN's strategic priorities. Our proposal aligns with every one of the Waterloo Wellington LIN's strategic priorities. Their priorities separates them into four main goals: access, connect, protect, and inform. The first, access, relates to providing timely access to care. The care is made accessible by being made available to any child in the school who would be in class regardless, in one location such as a cafeteria. Having a breakfast program in their school would make it easy for a child to have the breakfast they're missing at home.
Next, connect relates to care, which focuses on home life and community factors being brought into the idea of being in good health. This program is community-oriented and does not take place in a medical setting. It is provided to a neighborhood of children which can benefit from the program together. This particular initiative is imperative to the healthcare system as it encourages a holistic view of patient health and addresses the biopsychosocial root of the problem. A child who is brought to the doctors because they are experiencing symptoms of fatigue during the day could have avoided this visit by improving their diet with programs such as this one. Or a child experiencing poor academic results can improve this by fixing their diet. It targets an issue which originates in the home, potentially as a result of the family's social standing.
This relates to the Protect portion of the Waterloo-Wellington-Lynn strategic priorities. It focuses on the sustenance of the healthcare system and ensuring that it'll succeed in continuing to provide high-quality care over time. As mentioned previously, avoiding trips to the doctor when some issues can be solved by eating healthy at breakfast time or otherwise helps our healthcare system focus on patient problems which can't be solved without medical intervention. This focus will help with the efficiency of the system and save costs. The Protect portion also talks about engaging community members in healthcare initiatives, which is where the community aspect of this program is important. This initiative will be run by community members such as school staff or volunteers, which involves them in the process of helping the children in their community.
Lastly, Inform encourages healthcare initiatives to educate people and patients, including promoting disease prevention. The breakfast program for hungry children highlights the issue of not eating a healthy breakfast and its effects on young minds' learning efforts. The introduction of this program will bring attention to this issue for parents and children alike, improving the health of children and preventing poor academic performance as well as overall well-being. This initiative aims to educate families on the importance of breakfast and to encourage practicing the model of eating a daily breakfast. In addition, it educates students and families on the idea of nutrition and provides opportunities for them to learn and practice vital life skills, such as food preparation and how to better choices regarding food. Now we are going to look at the outcomes, which is the anticipated short-term and long-term outcomes of this program. This program will affect the community in several positive ways. Its effects will be visible shortly after implementation and will have a lasting impression on children's academics and health, in addition to the ways it will benefit the healthcare system.
Many of the major benefits observed from the implementation of breakfast programs are long-term. This is significant as it ensures ongoing success in both academics and overall student health, as well as lasting effects on the healthcare system. One of the long-term benefits of this program is the improvement of graduation rates. A study conducted between 2008 and 2009 in Toronto compared the graduation rates among children that ate breakfast and those who didn't. The results showed that children who ate breakfast had an average graduation rate of 78%, while the rate for children that skipped it was 14% lower. These effects are not observed immediately, but rather as a result of consistent habits. Maintaining the habit of eating breakfast will supply the body of the necessary nutrients to stay energized and engaged in the learning material they are exposed to. Part of this factor includes that better test results have also been observed as a result of eating a daily breakfast. Students who eat breakfast the morning of a standardized test have significantly higher scores in spelling, reading, and math compared to those who do not eat breakfast. Students who perform better in school are more likely to graduate, showing a clear correlation between breakfast and graduation rates. Furthermore, children who took part in the School of Breakfast program, where the program was offered at no cost to students, demonstrated improvements in attendance and punctuality. Clearly, there are layers to the benefits of a School of Breakfast program. The more students go to class, the better their performance and the more likely they are to graduate.
A vulnerable population includes students who are at a disadvantage due to their circumstances. Students from low-income families are part of this group and are the target of this problem. If academic performance is being affected by factors which students cannot control, this is unacceptable and steps should be taken to help alleviate these difficulties. In addition to this general group, First Nations children are among the most vulnerable, as a staggering 40% live in poverty compared to 17% of all Canadian children. These children would benefit greatly from an initiative which caters to their situation and sets them up for success. Next, this initiative will positively affect the healthcare system by reducing costs. As mentioned previously, the academic performance improvements come from the nutritional benefits of eating breakfast daily. These benefits also translate into children's everyday lives and will result in them feeling better and more energized, resulting in a better mindset for decision making outside of a school environment as well. If a child is often tired and groggy as a result of poor diet, this could result in unnecessary doctor visits. Preventing these unnecessary visits by targeting the problem at its source before the interaction between the patient and the healthcare system will reduce costs and economize primary healthcare providers' valuable time.
In conclusion, Breakfast for Hungry Children is a community-oriented program which aims to feed children who, for financial reasons or otherwise, don't eat breakfast before coming to school. In order for this program to be successful, planning and organization is important. Undergoing thorough planning before implementation will help prioritize issues and set goals, plan for action, set plan for action. This initiative is being proposed to the Waterloo Wellington because it concerns nutrition, instilling the healthy habit of eating breakfast for school children and improving overall health with the benefits this program provides. Implementing a breakfast program will result in long-term outcomes which will be observed in many ways. Students who will eat breakfast as a result of having it available to them will experience improved attendance, academic performance, and graduation rates. In terms of the healthcare system, it will improve the sustainability and therefore quality of it by making it more efficient. We hope you enjoyed our presentation.